Dr. MacDonald and Mr. Caulfield, thank you very much for speaking with me. First of all, is the situation getting worse or better in terms of non-vaccination?
So I could be evidence-based and tell you several studies that have looked at increasing numbers of people that are hesitant, meaning their children are not fully immunized, on time, on schedule, all vaccines. But I think what is really getting worse is the conversation around hesitancy. We have many more people talking about it, many more people worrying about it, many more people being hesitant to do on time, on schedule.
So it's becoming a bigger battle to persuade people of the benefits of vaccination. Timothy Caulfield, you have some incredible figures about hesitancy and people's attitudes.
That's right. I agree with Noni. What's the problem is the growth in that hesitancy. So depending on what survey you're looking at, it's somewhere between 20 and 30% of Canadians have some degree of hesitancy around vaccination, which is, that's a huge number. And the worry is those hardcore anti-vaxxers, which is a small group, looking, depending on the survey, 2 to 5%, are having that, their rhetoric coming from that small group is having an impact on the vaccination hesitant. And so that is really, I think, where we need to put our efforts.
You identified two sources of the hesitancy. One, I think, was the famous autism study, which has been debunked many, many times over, and the other, I think, is about corporate profits and things.
Yeah, I think that those are two of the biggest ones. The vaccination myth around autism still has an impact, which is incredible, because it's, this is a study that was debunked, is held to be fraudulent, but it still causes concern. And there was one study done here in Ottawa that found that 28% of Canadian parents have some degree of hesitancy because of that myth.
Okay, so Dr. MacDonald, how do we counter it then? How do you counter it as public health officials?
I wish I had fairy dust and a magic wand, which I don't have. It has to be very multi-pronged. Some of it has to be education in schools, healthcare professionals, general public. It's got to be very targeted when we're doing our public health messages to find out what subgroup is not accepting immunization and what are their reasons. Because the reasons are many varied. They can be items like Tim has just talked about, but there's a lot of other reasons as well. We need to make sure that our public health programs for immunization are very accessible because we put barriers in the way. We need to talk globally and nationally. What are we doing to control the rampant misinformation that's on Facebook and it's on YouTube? And this is influencing people. This is very different than 10, 15 years ago. Facebook was not so big and it didn't have the same impact that it has now. And we know 5 to 10 minutes on an anti-vaccine website changes your intent to immunize. We've got to fix it.
Who are the frontline workers? Because one of the things I learned was, you got to focus on people, for example, like pharmacists, who now play a bigger and bigger role.
Yeah. So there are many different immunizers now at the front line. Family doctors, public health nurses, pediatricians, gerontologists for the adult immunization, pharmacists, a long list. And they all need education about this. And specifically, they're really looking, they may only have 5 minutes with this patient. How can they use that 5 minutes most expeditiously to get the best effect? And most of them have not been trained about micro or mini motivational interviewing, which we know works.
You're here at a special session sponsored by the Senate of Canada, but I want to get to that in a second, regulation and even legislation. But how do you counter the social media phenomenon?
Well, first of all, we all need to get involved. We need to be on social media. Physicians need to be on, public health agencies need to be on. In addition to that, I think we got to use some of the same tools. We've got to tell exciting stories.
You say celebrity culture, you even say.
Yeah, let's leverage celebrity culture. It's not going away. Social media is not going away. So we've got to use some of the same tools, and that means creative communication strategies, leveraging narratives, using images, using these exact same tools that you see the anti-vaxxers use in order to get across the good science.
So regulation, someone mentioned, for example, the commercial interests that are involved in anti-vaccine campaigns. You mentioned examples of what's been done in other countries.
Yeah. So the Fair Trades Tribunal in Australia took on one of these anti-vaccine websites that was saying there's two sides to every story. There is not in immunization. There's no debate. The science is clear. Vaccines, there's no two sides. They took them on for that as false advertising, and they won. And with that, the site lost its charitable status, which meant they didn't get money coming in from donors, shut it down.
Because there's money involved in a lot of the web activities that go on in all subjects.
They often are offering an alternative for you. Like one of the biggest Facebook groups in the US, and this was looked at in The Guardian in the UK, did a big story on it. More than 150,000 people on it. They were selling you high-dose vitamin C and said, you don't need vaccines, just buy my high-dose vitamin C products. $60 a time.
Regulation, that's regulation touching on it. Legislation, what can governments do?
Well, I think at the federal level, we do need more truth in advertising. I'd like to see Public Health Agency come out with bold statements, and we're starting to see that at the provincial level. I think we also need to start regulating these healthcare professionals that are spreading misinformation, that are alternative practitioners that are regulated, that should be shut down if they're spreading this information.
A last point, and I know this from personal experience, having two members of my family who are healthcare professionals. It's difficult for them sometimes to make the discussions. You had a suggestion about medical schools.
Yes, one of the things that we know absolutely drives curriculum, whether it's nursing school, medical school, pharmacy school, it's the national licensing exams, or in some instances it would be provincial licensing exams. If you put questions on immunization on the licensing exams, it will come into the curriculum, lickety-split.
Doctors will become more familiar with making the case.
Yes, and because immunizations is so important, I don't think people really understand this. We gained 30 years of life expectancy between 1900 and 1999 in Canada. 25 of those 30 years are due to only 3 things. Access to clean water and sanitation, and immunization are 20 of those 25 years gained. Antibiotics got us the other 5, and then everything else we did in healthcare, whether that's cancer therapy or everything else, got us 5 years. So we need to pay attention to this.
Okay, well, I want to thank both of you for taking the time. Thanks for sharing your thoughts and your ideas. Thank you.
Thank you.
Welcome.